Daisy Ventura is professor of the Institute of International Relations of the Faculty of Public Health of the São Paulo University. He's a doctor in international law, University of Santa Maria, legal consultant in the past of the Mercosul group in Montevideo, and she coordinates the study group on internationalization of right and justice, transition justice, and the project on Cosmopolis, which is a university extension course or project on migration. Thank you very much, Flavia. Good afternoon to you all. I was born in Santa Maria, Rio Grande do Sul, not far from Rivera, and I lived 3 years in Uruguay, but I have forgotten my Spanish, which I need to polish it up. Anyway, I will try to speak Spanish, and if it is not, it's burdensome for you, please let me know, and I will speak Portuguese. I believe that I was commenting in São Paulo with Dr. Karina. She was not aware with a very Portuñol, Portuguese and Spanish wild language, which is the language of the future. Please let me know if you don't understand, and I will continue in Portuguese. What I would like to how do you do it? This way?
Tá. Isso então, pronto.
During lunchtime, I changed my presentation to include Maria José's phrase, which was perfect for my presentation. The manager said how to adopt a common focus on human rights, especially the right to health, in different health systems. How to speak in right to health in a block if some states do not consecrate the vision of the right to health. And I don't have the answer, I can say. But I believe that it is, as Dr. Karina said, I thank her for the invitation to be here. It's an opportunity, it's an invaluable opportunity for me. How, as she said, we need to face the challenge, although we don't have at the moment the right response, because we have migrants instead. In Brazil, we are calculating that we are having some 300,000 migrants. We don't have any option but to face the question. And to face the question under the perspective of human rights is very, very important. It may be a question of decision for the life of these people. On one side, we have the overview in the area of health and migrations, which is very, very different from other sectors, for governments. And then we can have this outlook from the area of health in two great aspects. The first is on epidemiological surveillance system, which are really, really relevant. But there are many strategies, studies, and comprehension of global health worldwide that in view of which the vision of sanitation security is not very, very different from the general view on security. And there is a risk also. I don't know if you are following up the evolution of the global health agenda. Since the Ebola crisis, we have had a very relevant change, and in the discussion of states and also at university in all the sectors, there is a trend on the predominance of the security of global health, among other possibilities that we were building up as years went by. Brazil has been a very important player with the work of the Fiocruz and Dr. Temporan, Dr. at the Isags, Dr. Temporan at the Isags, and his vision of the Unasur, coordinator the positions in the World Health Assembly, that transmitted a very different view from that of global health. That doesn't have in the first term the focus on surveillance. We have to see migrations, international migration, under a perspective of health, but also of sanitation security, may negatively impact on the rights of people. I mean, to be concerned with migrants as people that may transmit diseases. This is not important for us at present. Now, the focus of health, or the focus on migrations from the viewpoint of health and their rights, this is our challenge. That's what we need today. I would like to think together with you what the central ideas we could inspire this scope. I start with the Brasilia Treaty of the 2008. Regrettably, I am an attorney and a professor of international law. The rules, I will be focusing on the problem of these norms that they have in the region and the contradictions with some national legislations. But I would like to give you initially an idea that we have in the Unasur Treaty, which appear in the text in Article 3, defining the purposes of Unasur. We have consolidation of a South American entity through the progressive recognition of rights to the national of our member state. And then we have access to social services and health services. We cannot, it's a programmatic norm, cannot be applied immediately, but we can take the idea that South American citizens comprises universal access to health services. I believe that we mentioned in the morning the opening of the workshop, but I am also would like to remind this idea expressed by the Unasur General Secretary, not presenting international migration and migration as a problem or as a menace, if a threat. They are not a threat. I'm not comparing with, who I'm referring to, with a threat that comes from Europe. And everything that we cannot do is inspire ourselves on the European paradigm, because we cannot do it now. Definitely, and here we have an element that I think it is important. Another element is the idea of circulation of 430 million South Americans in the region. The idea of a South American citizenship as a free circulation of people, that it is very positive indeed from a regional view, but not very, very negative as regards migrants from third countries that, as they're presented from the International Migration Organization, this is very important. There is a diversification of migration flows that cause perplexity in many countries that were not used to certain migration flows that have intensified lately. They have diversified also in recent years for various reasons. And this South American citizenship vision tries to make foundation from the idea of free circulation of workers as an element of commercial or trade policy, as an element of economic and commercial integration. Unasur goes beyond from a free circulation that serves a common market, as in the case of Mercosur. Mercosur has another role, which is more interesting than the building up of a common market. But anyway, what we try to say is that for us, it's not simply a question on economy, but free circulation of workers, but it's the act of building up a broader citizenship and guaranteeing a right to migration in our soil. It is important to note, as Leonela said this morning, that there are a lot of rhetorical, and there is a great distance between reality and rhetorical words. I am very happy to see that Unasur has the intention of building a migration right in our region. We don't have it in our region at present, no, and we don't have it in other places of the world. I use the expression poor relative in the area of human rights because migrants are not very clearly consecrated in the Universal Right Declaration. There is a clause that allows traveling in our territory, living in our country, but doesn't permit going to another country necessarily. And what we have seen, on the contrary, are policies, restrictive policies on migration. There's no doubt that the national state has to define the rules of migration. We may have cooperation agreements, we may have processes of the European one creating a regional citizenship, but this doesn't take from the start the power of defining migration rules. This is the first thing we think when think about the rights of migrants. Most of state perceives the liaison between nationality rights, which are interesting for the topic of health, or of from one state or certain states. Then we could summarize that there is a general right to leave the country, but not a generalized right to entry the countries. For refugees there are, but what we see is that fundamental principles in international law for refugees are not being respected. For example, the declaration between the European Union and Turkey is a negation, an infringement of the principle of non-rejection of migrants. Some authors denounce a series of people negotiations because there is a change of people that are being returned to Turkey. So theoretically, refugees have a right of entry, but in the practice, we have problems. And I'm not referring to the poorest countries. I'm speaking about the larger PIB and GNDP, which is the European Union, the largest world player. I would also like to leave the idea that free circulation of people, global economic globalization promised free circulation. Never in the history there would be more intense circulation of people. And this, to a certain point, this is true. If we take some data from the tourism organization, more than 1 million people internationally circulates for tourism or trade or business. This number is increasing year after year. But if we have 1 billion people circulating, in our studies we have the affirmation that 2/3 of the humanity does leave the place where they were born, not because they don't want to dead, it's because there is no network or they don't have financial resources to do it. Money is not enough to leave a country. We need to have a network of contacts for that. So we can see globalizations from two points of view. First of all, 1/3 that goes around internationally, and that is inserted in the economy in a logic of rights, and they have the possibility of access to mobility, but 2/3 of the humanity cannot leave their homelands. So globalization is exactly what it seems to be. This is very quick because this was very well addressed in the morning by our colleague from the Migration International Agency. What I would like to speak to you is about this publication, infographics that we have prepared for this magazine, which is called South Magazine of Human Rights, which is free access on the internet, English, Portuguese, and Spanish. We have a dossier on migrations and human rights with infographics like those that appeared before that, with data on human biology, refugees, migration, and so on. And in this dossier, there is an article of a great Argentinian academician, Pablo Seriani. He is carrying out a very important work. And what I would like to leave as a central idea of what I'm going to address is a critical vision on this dimension, refugees, economic migrants, and so on. So Pablo, in this dossier, writes an article where he tries to deconstruct the idea that an international protection must be provided only to refugees. And he also is against the concept of economic migrant. It is necessary to provide international protection to all of them. And the idea is based upon a reality that we are living today, which is the difficulty who is forced to leave and cannot stay in his homeland, and who wishes to leave his homeland or her homeland. These divisions are like the after-day view of epidemics, climate change, many factors that make the extinctions more and more difficult. Anyway, this was already addressed. We have to deconstruct the idea that migrants of the south go to the north. That is the past. Migration south already is higher than south-north migration. This is another idea that we have to forget, that we all want to go to the developed world, Europe, USA. If we hear the campaigning discourses in the US, it seems to be there is an invasion of migrants in the USA. The same when we follow the elections in the European countries, they have the other impression. That is not true. That is not true. Not for the viewpoint of migration, nor from the viewpoint of refugees. Countries that receive more refugees are Turkey, Pakistan, Lebanon, Ethiopia. European countries are far from being the first destination of those refugees. 89% of refugees are in the developing world, and these problems have many problems, and they have the right to speak about crisis of refugees. Really, Lebanon, Turkey have the right to speak about refugee crisis because the number of refugees really is incredible. Europe is selling the picture and the security paradigm also in the area of health. And this is not, it is not the legion that is more invaded by migrants or refugees. In our region, the most concrete topic that we call in HOT, the hard law, the hardcore norm, the hard legislation, in addition to all the summits, declaration, where you have a juridical instrument which is very, very important that benefited thousands of migrants in our region. We have to refer to the residence agreements in Mercosur, something very concrete, and they are an example of our possibilities in terms of initiatives and taking the necessary steps and measures that are necessary for the protection of the rights of migrants. This agreement was signed in 2002, although it is in force. It came into force later in Brazil in 2009. In Brazil, it is difficult to make a differentiation between the benefits granted by this agreement or by the 2009 amnesty law that benefited migrants in Brazil. But this is a process that has regularized thousands of people in Brazil and in other states. Although there are sometimes in Brazil some confusions regarding the regularization mechanism and the agreement itself, the residence agreement itself. It is very important because in practice today it reaches all the South American countries except Guyana and Suriname through by the hand of the Association to Mercosur. All the members of the Mercosur have finally accepted this agreement. And evidently, the enforcement of this agreement requires internal adjustments, or we may say that the Mercosur residence agreement is the great step towards the right of migration, with a problem that I have mentioned before, that for our health system is something very, very important that benefits South Americans and other nationals from third countries. This is a step to the right of migration of South Americans.
I don't know if I did well here, but the first problem is in terms of the application of the residence Mercosur agreements and other agreements that allow for their application. In a nutshell, I don't know if you remember, otherwise we can talk later in the Q&A session, but essentially the whole idea is that with a set of very small set of documents, you can have access with 2 years residence. After 2 years, this residence can become a permanent residence. The requirements also, according to the text of the agreement, there is a possibility, depending on national legislation, that what's being demanding is actually the certificate of health from the migrant. Brazil, for example, doesn't have this demand, but here we have a problem. Some states may put actually as a condition the health of migrant for him to allow to enter the country. This is actually incumbent of the states. If public health legislation of a country says yes, it's okay. Otherwise, not necessary. So each state has this discretion, possibility of choosing if they are accepting or not a migrant that has a health condition. We can advance. We can change this provision. Also, we can identify 3 groups of countries in terms of this type of domestic legislation. Since I work in the secretary for 2 weeks, I learned one thing. I'm not going to be identifying which countries are in which group, okay? I don't want, I want the friendship of all those who are here. I'm just going to say that there are 3 groups. The first one, which is where there is a better compatibility with the application of the agreements. There are difficulties in applying the residence agreements. There's implementation of legislation that has been approved throughout the last decade that guarantee human rights. So there's a less friction between national legislation and the regional legislation code. There are states that are still discussing in legislation in effect, and there are changes in the horizon. And finally, there are other states that have not initiated any review process yet. Clearly, option number 2, option number 3. There is an agreement of residence, but this agreement is confronted against a national legislation which doesn't match this agreement, is not compatible with this agreement in many areas. For example, since we don't have a protocol or another regulation of the residence agreements in common, actually requirements can be interpreted according to the focus. The states that do have a national legislation which is more restrictive should regulate this. This regulation be done nationally for now. They should put additional difficulties to the recognition of this temporary and permanent residence later. In terms of health, the resident agreements make no reference to the word health or public health, but they do refer in Article number 9.3. I believe that I skipped one here. You see it. Item 9, the ones who recognize the rights of migrants and members of the families, ensures equality of civil rights, and amongst the rights that should be provided in equal conditions as nationals are to be found the rights and civil freedoms, liberties, the right to health, cultural, economic rights too. Then, the focus of the agreement of residence, even though there is no specific reference made to health, it means equality actually of access to health. Also, we said there is no recognition of universal access and free access in a state. Then we are exactly in the same place where actually when we started, be it what he can do is not ensuring a right to health of migrants, but can ensure the quality of treatment. It's not minor, but it's not enough to ensure the health of migrants where it doesn't exist. And in point number 3 of Article number 9, it talks of equal treatment with nationals, especially which are the compensation or remuneration articles under the perspective of circulation of workers or social security provisions. We have the residence agreement of first Argentina that has proposed these agreements, that have taken the flag of these type of agreements within Mercosur, but also the coordinators of unions, social and citizen participation mechanism of Mercosur that have demanded from the governments the residence agreement. They should be incorporated to the states and implemented, so forth. So we have the protagonism in Argentina, and also the social protagonism also by workers in the region in favor of this type of agreement. So there is a special concern with workers, and here perhaps we could also have juridical support when we talk about equality of conditions, actually equal treatment with nationals in terms of working conditions, imagining those states where there is a protection to health linked to a job, to work. Here perhaps we could extract here an element in that sense. What would be the challenge for the implementation of resident agreements today in Mercosur? That, as you have seen, also reaches also the whole of Unasur region, and that refers also to health, and it is a heterogeneity nature of different national legislation. A resident agreement has been made, but there's no harmonization in national legislation in terms of health and migration. And also, I don't think that this will be a concrete possibility to follow, but not even yet in migration policies. And we then have an efficacy which is different among the states that subscribe this agreement. Some also very simply are not implementing the agreement. Others are well advanced in some items of the agreement. And also within the states, there are different interpretations depending on the sector of the government, depending on the region of the state. There are different interpretations on the reach and scope of the agreement. There's no manifestation by the dispute settlement mechanism of Mercosur yet. But also we still have pending. The challenge here would be, I'm trying to follow what was requested by Dr. Karina, and of identifying the challenges, perhaps, although it may dare to make a few proposals too, but here clearly the issue is heterogeneity of the application of these agreements, even though despite have been an important step. I would like to talk about Sao Paulo. This was not in my presentation, but since we heard about this morning this issue, I think it was very important, because I do fully agree also with the vision of international migration organizations. He has drafted a report in terms of migration to the city, perceiving the local dimension is the one that has to provide an immediate response to the arrival of different migratory flows, and other manifestations that have emerged in the morning debate. I think the issue of the city is very important, and I don't know if the representatives of Brazil were going to be talking about this tomorrow, or they're going to be talking about São Paulo. I would like to apologize for the spoiler. I'm anticipating myself. I'm not going to talk too much about this, because I guess this my time is up almost. But I just wanted very simply to say that São Paulo actually was turned into a locus actually for these flows. South American migration came to São Paulo. We have a strong presence of South Americans, of Bolivians, Peruvians, Paraguayans that came to São Paulo, but it was turned in the last 4 or 5 years into the locus of passage of migrants from other nationalities that wanted a job in the south of Brazil. And of course, here I'm making reference specifically to Haitians that have been of migration that came through Sao Paulo. African migrants also, I should mention, they generated responses in the city of Sao Paulo that have been, from my viewpoint, very interesting. Then the Secretary of Human Rights, also the city of Sao Paulo, a coordination office for the policy of migration was set up, justified first, especially through the need of giving humanitarian assistance to these people that came through São Paulo, was going elsewhere, but just in transit. And also the assistance mechanism where actually Caritas, also different organizations were overburdened. Those who actually welcome migrants and refugees were overloaded. This overload generated a demand in terms of the municipal authorities. So where is this people? Where are people going to be eating? Where are going to be sleeping? The health conditions. Well, at first, a center of reference was set up that welcomes and that receives these migrants where they just when they arrive. And this coordination policy for migrants that is in the Secretary of Human Rights of the City Hall perceived that it was necessary to articulate the different sectors of the municipal government, and that education, that health were not mentioned. We didn't talk to each other. Social welfare, the secretariat that deals with jobs and work, realized that they need to network and ended by formulating with a social participation or even by migrant delegates that have been elected directly in the different communities, formulated a local joint policy for migrants that has been approved by the municipal parliament, the councilman, and then São Paulo today has a local policy approved at the legislative municipal level, and it's expected that this policy won't actually change in the government of the day. We're going to be having in January, and we have a new mayor, and also the extension of the Secretary of Human Rights is going to be extinguished. With the new office, there will be a new reorganization of the Secretariat, and of course, that we have the fear, justified fear, because of the announcements actually of the extension of the Secretary of Human Rights. I don't know where the coordination of policies for migrants will be located. We trust in the challenges of a new management to recognize what has been done, what works well in the municipal administration, and we have the hope, a big hope, that this coordination policies for migrants will persist. The city hall has no option. It has to apply the local policy for migrants that was turned into legislation, and we're there to demand actually the application of this type of policy. But I believe that it's a case that also is very important because of the practical mechanisms that have been found in the health units to provide response to migrants. I just wanted to suggest this article, which is in a dossier we published about on global health in a magazine journal. This article especially brings a lot of information and practices also that I hope might be useful to you. When launching this dossier in Sao Paulo, we had Dr. Karina Banza for our joy introducing the Isags activities. This report has an article or this story that talks about the issue of health in local policy for migration from Sao Paulo and explains how the different health units that are located in regions of the city where there are migrant communities, big communities, they have developed specific strategies. For example, article is called Pata Jorge because Jorge is a mediator, is a community health agent from Bolivia who lately has been a fundamental character when taken to Bolivians, especially to Bolivian women, to the health system to tell them, despite you don't have the documents, you will be cared by the health system. Don't fear the police. The health agents won't call the police. You can come to the hospital in transmitting ideas of prevention and basic care, primary care of health, mediators, those community agents that are also migrants from this community have been, from viewpoint, have been the success of this policy, but we don't have enough migrant community agents. The title of the story that has been written by two researchers under my guidance from USP. We don't have actually the name of the author. It's because of my lack of skills, because I prepared this slide now during lunch. But they call Isadora Stephens and James Martins, and you have this presentation available to you, and you have the internet address. But they chose this title because also we need more migrant agents, and I believe that there's a very interesting local response that can be adopted, I believe, in other places too. How many seconds do I still have left? Half a second. Okay, Flavia, thank you. Okay, just going to be making a short reference to the Inter-Mexican system of human rights, especially to see the job carried out by the Institute of Public Policies of Human Rights from Mercosur. I believe that it might be a very interesting partner for Isags in this activity, because we call this IPPDH, which is a long name, Institute of Public Policies for Human Rights of Mercosur. Here we have Andresa who does belong to this institute, has been doing a great job in terms of migration. From a deep analysis on the city of Buenos Aires, now we do, because my group researcher has participated in this research coordinated by EPPPDH, and we are taking the snapshot, the diagnosis of South American migrations in Sao Paulo. I have interviewed 44 migrants lately, with long interviews held, comprehensive, where each one tells their story, and especially with a focus of access to public policy. So we're going to be having a lot of elements. This survey is being concluded, and I invite you all to follow it when it's to be published. Shortly we'll be able to have it, but it brings a lot of information, in-depth information, even despite the difficulties, and we see the failures. It shows the successes, what has been accomplished in São Paulo. And the Institute also has other types of important publications that I don't have time to list, but everything can be found in the site, in the web and in the internet, in the website. Simply, I would like to ask, please, to understand the principle that was established in this consultative opinion, which is the link between the rights to life and personal integrity with human health care. Even though we have a legal code that consecrates the right to health under the terms of the Brazilian public health system, actually we can have the right to life and personal integrity that includes an element of defense of health care, so advocacy strategies, and this comes from a case in the Inter-American Commission that we call Andrea Mortlock against the United States, where a migrant from Jamaica was to be deported from the United States, and the Commission said the United States cannot deport this migrant because in Jamaica she will have no access to treatment. She was HIV positive. And then the conclusion of the Commission was that this deportation would be actually a sentence to premature death and extended suffering. So the American system now would also actually wants to protect the health of migrants, and the consultative opinion actually focus on migrant children. But we have a conclusion of the right to health that could be interesting in the times of strategies to be adopted of these rights. You can see that I'm for activism, I'm for rights. I hope that we'll never be confronted against each other in this activism. It's interesting to listen to the other side. So we are following these changes in terms of South American mutations, South American migrations. So it's at the end of the presentation. I want to thank you all for being here. And as I told Karina, tomorrow we are going to listen to the representatives of 8 states. For us, is kind of 2 or 3 years of empirical research conducted, and now we'll be able to hear them all within the framework of this wonderful workshop. Thank you. Good afternoon to all of you.